Session 3, Basic Biostatistics. Session 3.1. Biostatistics in Health and Safety. Biostatistics refers to the application of statistical principles to questions and problems in medicine, public health, or biology. A basic knowledge of biostatistics is relevant to health professionals in terms of data-driven activities, public health impact, occupational medicine. Role of biostatistics in OHS. Biostatistics largely contributes to research and practice in occupational medicine, such as in the following situations: assessment of exposures, assessment and quantification of outcomes, assessment, design, and evaluation of interventions, preventing and monitoring disease occurrence, guiding the creation of guidelines and policies. Application of biostatistics. Given the varied and multitude use of biostatistics in occupational health, a greater focus is limited to three domains: description of patterns in data sets through various descriptive measures, descriptive statistics; drawing conclusions regarding populations through various statistical tests applied to sample data, inferential statistics; application of modeling techniques to understand relationship between variables, statistical modeling. Future directions of biostatistics and OHS. Currently, there appears to be an exciting future directions and opportunities at the intersection of biostatistics and occupational health, such as exposome analysis, genomic analysis in occupational health, predictive modeling, occupational surveillance, data-driven decision-making, integration with administrative data. Types of variables in biostatistics. Classification of variables can be answered in two possible ways: based on how they are measured, or based on the roles they play in a study. Based on measurement. Qualitative variables refers to non-quantifiable categories. Uses numerical representation as labels or codes only. Usually deal with descriptive statistics only. Examples: sex, degree of jaundice, educational level, eye color. Quantitative variables has values that indicate quantity or amount. Can be further classified as either discrete or continuous. Deals with both descriptive and inferential statistics. Levels of measurement. Nominal. A classificatory scale, uses labels. Represent mutually exclusive and exhaustive classes. Example: sex, blood groups, clinical diagnosis. Ordinal. Like nominal data, but its classes can be ordered or ranked. Can be qualitative or quantitative. Example: disease severity, age group. Likert ratings. Scale. Like ordinal data, but the distances between all adjacent classes are equal. Can either be interval or ratio. Example: temperature, blood pressure, PCO2. Based on their roles in a study. Dependent. Outcome, output, result, effect. A variable whose value changes as the independent variable changes. Independent. Input, predictor, cause, risk factor, exposure. Variable known or attributed to the changes in the response variable. Confounding. Also known as extraneous or intervening variables. Other factors/s contributing or unintentionally influencing the study findings. Effect measure modification. A type of variable that changes the magnitude or direction of association between the variables. Dummy variables refers to a makeshift variable, numerical in nature, to represent categorical variables. Important points. A variable can either be quantitative or qualitative at one point in time but not at the same time. A variable can be classified under one scale or level of measurement only at a single point in time. A variable can be quantitative or qualitative, depending on the objective of the data collection. Likewise, the scale of measurement can vary depending on how the variable is treated. Why study biostatistics? To make sense of massive amounts of information. Needed to avoid reaching invalid conclusions out of limited data. The ability to generalize from a sample to a population is hardwired into our brains and has been observed in 8-month-old babies. Essential to avoid being fooled by seeing apparent patterns among random data.